Good evening, everyone. Today is our last day for the PSD Select Series 3. So before that, let us first start with a prayer. Let us put ourselves in the presence of the Lord. Dear Almighty and ever-loving God, we glorify and thank you. You have showered us with so much blessings. Your presence continuously reminds us of your faithfulness and guidance. We humbly ask you to shower our speakers today for your greatest inspiration so that they may share the most of their knowledge, heart, and soul to their respective topic. May we absorb the invaluable knowledge and put it into practice what we may learn today. We pray that you bless all the committees in charge, that they may be able to fulfill their tasks responsibly, that the objective they have set may all be achieved. Your infinite blessing would mean the success of this activity. May we be living witnesses of your genuine love through the enactment of the knowledge acquired through this activity. We ask this in the name of our Lord and Savior. Amen.
Philippine Society of Diabetologists. PSD's mission: the pursuit of excellence in diabetology. PSD's vision: excellence in diabetology. PSD's objective: to keep abreast of the most recent developments in all fields of diabetes research, education, and treatment.
PSD Statement of Purpose. The purpose of PSD is to give persons with diabetes lives with qualities unaffected by the condition. This is their right more than a privilege. This passion sustains and empowers us to find meaning and fulfillment. The purpose of PSD is to understand and accept that diabetes is a complex condition affecting an individual, the family and community. Knowledge of its biomolecular and cellular origins and understanding all its interventions are as important as mastering its psychosocial dynamics. The purpose of PSD is to be a family of responsible persons bonded by one passion. Agreeing in disagreements strengthen our unity. Criticisms fuel our growth. Love fills our camaraderie. The purpose of PSD is to be a source of inspiration that informs, guides, and corrects one another in daily practice. We find happiness in sharing knowledge and experiences that improve patient lives. The purpose of PSD is support individuals and organizations with similar noble goals, acknowledging that we all live in one world and fighting diabetes together multiplies good outcomes with a fraction of the effort. Collaboration drives inspiration, motivation and creativity. The purpose of PSD is to welcome the cure. When diabetes no longer exists, we will reincarnate with new passion and direction. Our vision will evolve with time, but the family lives on.
Philippines.
Welcome to PSD Select 3 Series 5. Here are the special edition lecture being done during this pandemic caused by the COVID-19 virus, which infected millions of people, wherein mostly affected are our diabetic patients, and they are at risk for contracting severe complications caused by this virus. With us, on behalf of the PSD Board of Directors, has taken this opportunity to enhance the knowledge to pursue our excellence in diabetology during this time. In line with this, we are having this third PSD Select 3 Series 5, wherein series of virtual lecture keep our alumni abreast on the information of diabetes. Our objective here is to discuss the update on pathology and management of microvascular and macrovascular complication of diabetes. For tonight's program, we have a Pharma CME Gram care of LRI Therapharma. The topic, preparing patient with diabetes for dental procedure, as Dr. Rimatan as our speaker, and for the PSD select speaker, DMN Healthcare, with the topic of common dental problem in DN to be delivered to us by Dr. Cromwell Gatchalian Yabut. And to start and to feel the spirit of Christmas, let us start with a raffle. Sir Bern, for this raffle, there will be 5 winners winning pulse oximeter. So Sir Bern, let's draw. So congratulations, Dr. Maderaso. Are you here? Nandito ba, Lynn?
Not here. Wala po.
Wala po. Okay, let's draw again.
Let's spin again, Doctora. So if you are here po, dear doctors, just turn on your microphone just to let us know that you're here. So Doctora, Jamie, next po.
Villanueva. Doctora, are you here? Sayang.
Sayang, wala.
Wala pa rin.
Wala. Alright, isa pa tayo.
Doktora Ana Marie Ignacio. Ito ka, Doktora? Wala pa rin?
Wala. Doktora, wala.
Sayang. Baka yung mga nanalo, Dr. Maderaso, Villanueva, Ignacio, baka you're here na. Let us know. Next, Dr. Rosalie Isidro Estiel.
Ano?
I'm here po.
Ayan. Okay, congrats, Doktora. Oh.
Thank you po.
Dr. Fred Valdez, are you here?
Wala, Doktora. Wala siya.
Okay. Dr. Rene Gonzalez. Here ka, Doctor?
Wala po. Wala siya.
Okay. Okay. Dr. Benedicto Sinoro. Here ka po, Dr. Sinoro.
Wala siya, Doktora.
Wala rin. Ha? Ayaw nila ng Dr. Jan Nazareno. Jan, dyan ka.
Wala po.
Ale, si Jan. Dr. Delisa ay out of the country. Dr. Evangeline Fabian, are you here, Doktora Pabian?
Wala si doktora, wala po.
Wala pa rin. Dr. Argana Marivic?
Wala po si
Ayan.
doktora.
Siguro sa susunod na raffle na lang, Bern, include natin. So we have one winner for this first raffle, Dr. Isidro Espiel Rosalie. Okay, so for the next raffle, add natin 4.
Add 4 mamaya. All right.
Okay, next. So we start with our Pharma CME grant brought to us by LRI Terra Pharma. Their products are as follows: for the diabetic care partner and also their cardiometabolic partners. And for our speakers tonight, is a graduate from a Doctor of Medicine at the UST College of Medicine and Surgery, currently a faculty of the UE-RMMC ISDFI, and the Vice President of ISDFI. She was the past President of PSD year 2012 to 2013, and also the ISD Alumni Association 2007 to 2009, and also from the DP Philippines, Diabetes Philippines 2015 to 2016. Our speaker is a graduate of Master of Science in IM, major in Diabetology at the UE-RMMC ISDFI, and finished her clinical fellowship training in diabetology also at the UE-RMMC ISDFI. Currently, she is an active consultant and training committee member of the Capital Medical Center. Let's all welcome our speaker, Dr. Rimata.
Maraming salamat, Jamin. Can you hear me now?
Yes, ma'am.
Thank you for that. Dapat nga, hindi mo na ako siguro ini-introduce. Magkakapamilya naman tayo. Anyway, so I was tasked to start na ba ako? Kumusta kayong lahat? Let me share my slides. So I was tasked to actually talk about preparing diabetic persons with diabetes for dental procedures. So, and medyo na-discover ko, marami pala akong hindi alam pag pinag-usapan itong diabetes and dental procedures. So, medyo natuwa din ako, no? Kasi, you know, we like to learn. So let me go ahead. As mentioned by Jamin earlier, LRI Terra Pharma is a sponsor of this talk and our webinar tonight. However, I would like to make it clear that I have made this lecture independently on my own, and I have learned a lot actually, and I would like to share what I have learned with you tonight. Okay. It is said that healthy mouths mean healthy body, no? At ang relationship na ito daw, no, is bidirectional, meaning one affects the other. So poor control of diabetes, blood sugar increases oral complications, and that includes yung dental, mga ngipin natin, di ba? And pagka pangit din ang oral health, naapektuhan din daw ang glucose control and stabilization. So it is really bidirectional. Kailangan parehong binabantayan, no? I think I have learned in this talk that in studying for this talk that malaki pala ang effect ng having a healthy oral cavity, no, that includes the teeth nga, in our overall health. Okay. Now, what are the oral risks of having a poorly controlled diabetes or hyperglycemia, di ba? Ang pinaka-common is having periodontal disease. And I think our guest speaker tonight will discuss this in greater detail for us. However, aside from periodontal disease, hyperglycemia in diabetes also can lead to salivary gland dysfunction, no, hypofunction usually, can lead to an increase in infection or even colonization of the oral cavity. There can be neuropathy as well of the mouth, no? May mga tinatawag silang burning mouth syndrome. And then there can be poor wound healing. So wound healing of any oral lesions, no? Or dental caries, parang ganon. Pero ang pinaka-common nga is periodontal disease, okay? Which I think will be discussed a lot later, okay? Now, I found this article which says that the non-modifiable risk factors daw of having chronic periodontitis, no, and having diabetes are very identical, no. So among them are higher age, being male, no, may ethnicity factor, low socioeconomic status, cigarette smoking, genetic predisposition, history of radiation, pancreatic diseases, polycystic ovarian syndrome, Alzheimer's, rheumatoid arthritis, among the many risk factors, okay? And of course, poorly controlled diabetes can be a common risk factor for both, okay? Now, bakit intimately linked, no? This is just one pathophysiologic slide, no, about the mechanisms kung bakit having hyperglycemia or uncontrolled diabetes can increase or cause periodontitis, no? So up here you will see that having diabetes or being hyperglycemic can increase actually the presence of periodontal pathogens. And I think, you know, candidiasis is very common for our patients, no? Fungal infections, among others. And we also know that when you are diabetic, there is an increase in oxidative stress. There's an increase in our advanced glycosylated end products, no? These things leads to complications. So all of these actually can increase the inflammatory response in the periodontal tissue. Okay. And what happens now is there's an increase in the receptor activator for NF-kappa B, no? Together with this interaction with its ligand. And there's a decrease in the osteoporoterigine, which is actually an antagonist of your rank. And when this happens, there's stimulation of osteoclastogenesis. So instead of ang effect maganda, na-destroy yung bone, no? So this leads then to alveolar bone destruction and in the end, loss of ating ngipin, no? So inflammation really does have a lot of effect in causing periodontitis, especially in patients with uncontrolled diabetes. Okay. So, back to the main topic. No? So, introduction lang yon because I had to introduce the topic by showing the relationship of uncontrolled diabetes and dental health. Okay. Now, I know we are commonly asked by our patients. Ako, I get a lot of this. Doc, kailangan ko daw ng clearance from you, from my dentist. Kasi kailangan daw bunutin, ayaw galawin ng dentist. Okay. Ayaw gamitin ng dentist, ayaw galawin ng dentist ko ang ngipin ko nang wala akong clearance sa iyo. Yun ang commonly asked question. So that leads us as medical practitioners or diabetes specialists to ask, meron ba talagang ganun? No? Meron ba talagang, ano ba ang basihan? What will be the basis? Or is there an expected sugar level wherein I can clear my patients? What is safe, in other words, no? So this is what I will try to answer kasi this is part of preparing our patients for dental procedures. I think ito yung pinaka-common talaga. Okay. So, normally, pagka daw ang ang procedure routine, and that includes examination lang or simple feeling or routine cleaning, wala daw need for special instructions. So remember, kung ganito lang na minor procedures na routine, there is really no need for special instructions. However, if there is a need, if there's going to be extraction or surgery on the sa bibig, then you will need to give instructions to your patients. Okay? Now, naghanap ako, no? Sabi ko, wala naman ako nababasa sa ADA, sa AACE, sa European guidelines na numero talaga na nagsasabi na specifically pointing to how to clear for a dental procedure. So I'm just sharing with you here the ADA position statement in the standards of care that the general A1C goal for our patients should be below 7%. So I guess this includes procedures such as for oral health care, diba? And if your patients are using yung CGM, then the time in range should be over 70% most of the time. So ibig sabihin dapat well-controlled sana siya, no? But the reality is a lot of our patients are not well-controlled. Kaya nga nasisira ang ngipin nila eh. Kaya nga kailangan ayusin because they are not controlled and they will need the dentist to do something about their teeth or their tooth, di ba? So what do we do? So naghanap ako ng other articles and this was actually the only one I saw, no? So this is a review article coming out of the Saudi Dental Journal. And the title is Management of Emergency Tooth Extraction in Diabetic Patients on the Dental Chair. So parang emergency kailangan nang gawin, di ba? And the objectives of this review article, no, was to determine the maximum acceptable level of blood glucose for tooth removal in diabetics. And secondly, to show a systematic technique for the management of patients with diabetes on the dental chair. Okay? So this was a review article, nag-collection ng mga lahat ng published articles, and they used the PRISMA guideline, no? So the PRISMA stands for Preferred Reporting Items for Systematic Review and Meta-Analysis, no? So it's a guideline that analyzes published articles and reports, no, to collect data, okay, to be able to show something that they're looking for, no? And in this case is ano ba yung safe na glucose levels. So ang statement dun sa article na yun, and actually the review included yung ADA, AAC, and the other guidelines in the world, no? So ang statement sa conclusion nila is blood glucose levels for selective emergency tooth extraction under local anesthesia should be considered acceptable if the dental treatment can be achieved with minimal risk, levels of risk, or in other words, with no signs of out-of-control diabetes. So ano yung out-of-control diabetes? What are they talking about? So in that paper, ang sabi nila, kung FBS daw, 180 is the cutoff point, no? And the term they use is selective dental extraction. I think this would also mean elective dental extraction, elective procedures in other words. And kung wala siyang FBS and RBS ang meron siya or 2-hour post, then the cutoff that is preferred would be 234, no? For an emergency dental extraction. So this is coming out again of that review from Saudi. So remember, kasi wala akong makitang ibang articles, no? Baka hindi lang ako marunong maghanap, but this is what I found. So they also have in that paper a table that shows us the safety scale of blood glucose level. So excellent daw kung ito yung numbers, good daw kung 110 to 140 ang fasting, 2-hour post below 180, no? 127 to 180. And acceptable kung below 180 nga ang fasting at kung ang 2 hours after a meal below 234, no? So kinolate nila yung data, systematic review, meta-analysis, and that's how they got to these numbers. Okay. So ang tanong nyo naman, Dok, kung HbA1c ang dala ng pasyente, ano ngayon ang cutoff? So I just derived it from the estimated average glucose table coming out of the ADA again. And if you look at this table, no, if the number of that we're talking about is 234 or maybe below 240 for random or post-meal, then that would give you an HB equivalent to about 9% HbA1c or below, no? So minsan kasi hindi natin, walang ibang dala ang pasyente, either A1C lang or fasting or random, then at least I think this will give us a sort of a guide kung pwede ba natin payagan yung pasyente magpabunot or hindi. Okay? Wala kasing talagang rule. Wala talagang itaga mo sa bato na ito dapat. Parang ganon. Ang sinasabi lang always in general, good control of diabetes. Okay? That's why para bang naka-derive lang yung numbers na ito. Now, why do we want the glucose control to be good? Ano bang magiging effect niya sa oral cavity, no? So the article also goes on to say that if the diabetes is uncontrolled, then there can be increased susceptibility to infections. Fungal infections are common, as mentioned earlier. And the other problem is when you do an extraction, you open there's a portal of entry for the pathogens that can go in. And in the worst situation, it has been reported that mucormycosis can happen, no? Because nga na-open mo, tapos mataas ang sugar niya. Kaya sinasabi ideally, mas maganda ang sugar before mag-procedure. Okay. And there are also already reports of poor socket healing. So poor healing nung pinagbunutan. If the dentist is doing a root canal, no, there can be an increase of non-retention of the root-filled teeth, no. Uncontrolled diabetes can lead to poor circulation such that kung yung terminal arteries, no, capillaries are affected, then walang circulation, walang oxygenation, and of course that causes a demise of the tissue that's supposed to hold the teeth, di ba? So that's why what happens is there's increase in tooth mobility and bone loss, which are important, I think, to keep the ngipin in place, no? And in some of the reports daw, this may trigger osteonecrosis of the jaw kasi the jaw bone is connected doon sa ating kung saan yung mga ngipin nakakonect, and pwedeng mangyari daw yun, but in the elderly, no? And I think in high risk individuals. So loss of the bone is really bad for our patients, no? And this can be nga, as shown earlier, caused by hyperglycemia or uncontrolled diabetes. So, kaya sabi ko, eye-opener, kaya pala, no? Parang I have not in the past kasi really read or gone into the details of why, how specifically does hyperglycemia affect yung ngipin natin. And I found out that these things can happen among others, no? Kasi there are effects of mga salivary dysfunction, etc. that can happen with diabetes as well. But in general, this can happen with uncontrolled diabetes. Okay. So, having said that, let us remember that when we are treating a patient who has diabetes with dental problems, we need to work together with the dentist, no? So it's actually the patient, the dentist, you, the healthcare provider.
Which we are about to receive and they wanting to try several things.
Parang may okay, thank you. So back to the slide, it's a teamwork between the patient, the healthcare provider, you, diba, the doctors, and the dentist. No? So, dapat nagko-coordinate tayo with the dentist for the care of the patient. And the patient also has to coordinate with both of us, the dentist and the doctor. Okay. So, ano ngayon ang role ng dentist pagka nagbubunot or may extraction, no, under local anesthesia? Ideally, we can tell our dentists, if they don't know it yet, no, that we would prefer an early morning appointment. No, just like any surgical clearance that we do, di ba? We always request for first case in the morning. This will minimize the risk of stress-induced hypoglycemia or hyperglycemia. Both ways yan eh. We need to, ideally, kung severely uncontrolled siya or kung brittle ang diabetes niya, may check tayo ng sugar niya or naka-insulin siya, di ba? And if very tight ang control niya, kailangan din yun because baka mag-hypoglycemia siya during the extraction procedure. Okay? Kung may sedation daw gagawin, no? Or local anesthesia at ma-affect yung kanyang eating after, then you have to tell the patient to eat before the procedure and adjust the medications as normal, di ba? If needed. And then maybe extra antibiotics can be given. Usually the dentist will do that to help address secondary infection. So remember that this same article says that the permissible level of glucose is 180 or even 200 daw, no? For dental extraction, okay? So pag emergency, then below 230 ang sinasabi nila. So again, this is only one paper. You may or may not accept it, but this is what the published paper says. Okay. Now you need to tell your patient also, no, to do these things, to eat normally before the appointment, to bring a snack. I always tell them that, as a soft one or a liquid one pag nag-hypo siya, to take the meds on schedule, to bring a glucose meter if they have one, to follow all the instructions as directed by the dentist, and to inform the dentist if there's something wrong with them. If they're not feeling well, they should tell the dentist talaga. So these are instructions that you give your patients, okay? And specifically, again, to emphasize, you need to watch out for hypoglycemia if the patient is tightly controlled or with hypo risk. And also, you need to watch out for hyperglycemia with or without ketosis. Of course, kung may ketosis, i-defer natin yung procedure. Diba? Okay. But there's a caveat also that we need to remember. While hyperglycemia will put the patient at risk, mali ang spelling, for infection and poor wound healing, it should not prevent also surgery if we think that the problem in the oral cavity or in the tooth is the one contributing to poor glycemic control. Well, grabe na yung abscess niya at hindi talagang, kailangan talagang gawan ng paraan, pero mataas pa yung sugar niya, then the minimum procedure to help the patient can be done, because hindi mo rin maaayos yung sugar kung grabe yung infection sa oral cavity, So, nasa discernment na po natin yan. Okay? But in general, this is what is mentioned. So, what else is the role of the diabetes specialist or the doctor, di ba? I think prevention is very important. So, ang sabi dito, even before the patient needs to see a dentist, dapat you are already talking to the patient about the importance of oral health in relation to how it will affect your sugar and also how the sugar will affect your oral health. Diba? So both patients, as I said, it's mutually, it affects each other, bidirectional. So kailangan natin i-remind ng pasyente natin they have to take care of their ngipin, of their oral cavity. Diba? They need to go to the dentist regularly for check-up. They need to really see them, for prophylaxis, for cleaning, etc. And then part of our role actually, kasi mas madalas yata pumunta sa atin ng pasyente kaysa sa dentist, is to screen for other oral conditions that may occur that are quite common in diabetic patients. And these are, periodontitis, candidiasis, orally potential malignant disorders. Common daw yan sa diabetes, yung potentially malignant disorders or cancers, dental caries, burning mouth syndrome, saliva secretion alterations, taste perceptions, halitosis, delayed wound healing. All of these daw are things we can, on our part as doctors, look for or screen in our patients, and then we refer them to the dentist if we detect them, no? Para early treatment. So as I mentioned, prevention is very important, no? And of course, trabaho natin yung paggagamot ng diabetes. So please manage the diabetes well together with the patient. Okay. Now, I will not teach you how to manage. Alam ko, alam nyo. As a reminder lang, there are many ways we can address hyperglycemia in our diabetic patients, and this is the ADA consensus statement. So depending on the type of patient you have, then you can choose the medications you want to use or you can use for your patients, di ba? Okay. And we have many medications as well that are available, tools to control hyperglycemia. So let me lang, as before I end, just thank our sponsor, no? Kasi syempre ni-sponsor niya tayo at malaking tulong sila din sa atin, no? If you look at the profiles of the anti-hyperglycemic medications we have, our sponsor actually has a lot of them to help us. So they have metformin in the form of Glumet, as mentioned by Jamin earlier. They have a DPP-4 inhibitor, Proglin, with metformin, Proglin Met, diba? They have Piozone, which is a TCD. And they also have sulfonylureas, Glubitor, and Norisec. So, yan lang ang contribution ni LRI ngayon dito sa talk ko tonight, no? Just to thank them for helping us do our CME activities. These are their products which you can use to help control the diabetes or the hyperglycemia of our patients. In general, if you will look at this list, Glumet, Proglin, Proglinmet, and Piozone will be neutral for hypoglycemia. So kung takot kayo sa hypo, medyo iiwasan nyo yan. If your patients are on Glubitor or Norisec, which are SUs, then you might, if you think high risk siya for hypo, you actually can reduce the dose, especially kung matagal ang procedure, di ba? Pero kung hindi naman matagal ang procedure at makakakain naman yung pasyente after the dental procedure, you can just tell your patients to keep on taking this, no? And down the line, these are the other characteristics of the drugs. But again, we just like to thank our sponsor for being with us tonight, no? So to summarize, kasi maigsi lang talaga ang part ko, no? How do we prepare persons with diabetes for dental procedures? Number one, manage the diabetes well. And then, of course, prevention is always better. We need to check the oral health of our patients. Madalas di natin pinapansin yan. Ngayon papansinin ko na kasi importante pala. And then we need to practice team approach, no? Talk to the dentist that your patients have if you need to para maayos, no? And then there's only one paper nga I found about the safe levels of glucose controls that you can clear your patients. So kung fasting daw below 180, RBS below 234, kung emergency procedure siya, di ba? So yan lang ang mabibigay ko numbers sa inyo for now. But in general, they say good glucose control. And then of course, what we need to watch out for is hypo and hyperglycemia as usual for any procedure, di ba? I think the most important lesson to take home is yung bibig natin, yung oral health is actually a window to our overall health. I learned this while preparing for this lecture. Ang lagi nating iniisip, yung mata di ba? Pag ang mata may problema, malamang may problema. It's a window to what's happening also in, for example, the kidneys. Pero yung oral health din pala. So kung meron akong natutunan dito sa pag-prepare na ito is we need to take care of the oral health of our diabetic patients because it can impact not only diabetes, pati heart, pati other systems natin na apektuhan. No? So it's a two-way thing. So a healthy mouth is really a healthy person, having a healthy mouth for that matter. So with this, I'd like to say thank you. Maiksi lang yung aking sharing sa inyo. And because baka hindi na tayo magkita, I'd like to say Merry Christmas. I pray that the Lord of Christmas will bless you with His love, joy, and peace. And may you sense His presence in your hearts every day. No? Keep safe mga kapamilya. Thank you. Okay na, Jamin?
Thank you again, Dr. Rima, for the very informative guidelines on how to give DM clearance prior to any dental procedure to all RDM patients. Thank you. Burn. Okay, again, in the spirit of Christmas, let's have raffle. For this raffle, there should be 5 winners again for the pulse oximeter. But since we're only 1 winner for the initial raffle, so we're going to add another 4 here. So there will be 9 winners of pulse oximeter. Please acknowledge if you are here, if you are the one who will be the winner for the raffle draw. Where wala yung raffle, yung ruleta? Ulit.
Wait lang, hindi nag-share. Okay. Doktora, may lumabas na po kanina. Doktora,
okay, sino ba yun nanalo na yun? Dr. What's that?
Christopher
Peralta. Are you here?
Wala siya,
Dr.
doktora.
Peralta?
Wala po.
Wala po. Okay. Valdez. Are you here, Dr. Valdez?
Wala siya, doktora.
Ah, din. Okay. Dr. Paul Valencia. Dr. Paul.
Wala si Dr. Paul. Wala po.
Wala rin. Dr. Maria Rowena Lingan. Lingan.
Wala po si doktora.
Hindi. Baka nandiyan na kayo, late na kayo pumasok. Dr. Valdez, Peralta, Palencia, Lingan. Please acknowledge. Dr. Evelyn Gamalio. Dr. Evelyn, nandiyan ka po.
Nandyan po si doktora.
Wow. Doktora, saan ka? Please acknowledge. Open your... Saan ka? Kahit lang, voice lang. Doktora, nandyan ka? Walang audio.
Doktora Evelyn.
Ayan. Okay, present. Yay! We have 8 more to go. Raimundo Noel. Noel Raimundo. Dolin.
Wala siya, doktora.
Dr. Julie Marcelino. Dr. Julie.
Wala po si doktora. Wala.
Yep. Dr. Arlene mga sir. Here ka, Dr. mga sir.
Wala po si doktora.
Yan siya, Lynn.
Wala po. Wala si doktora.
Wala rin. Gabriel Tan Jr.
Wala din.
Tan, wala din. Ramon Navalio.
Wala Wala po si Doktor.
Dr. Gina Ang.
Wala din si Doktor. Wala po
Natin.
si Doktora.
So, Rosemary Ponce. Natin.
Wala din po si Doktora.
Dr. Cynthia Lubaton. Dr. Cynthia.
Wala po. Wala si Doktora.
Okay. Sige, last
Ano ba?
three. Dr. Delia Ramos.
Wala din po
Karen.
si Doktora.
Okay, two more, tapos maya na lang ulit. Dr. Simonette Hermino.
Wala po din si Doktora.
Okay. Last, tapos maya na ulit. Dr. Ellen Bergonio.
Ayan, nandito si Doktora. Doktora.
Dito si Doktora.
Acknowledge po, Doktora.
Nalay,
Dr. Ellen.
Doktora. Diyan ka, Doktora. Doktora, kahit sa chat box po. Hindi ko makita. Doktora Ellen,
Saan?
dito ka.
Nan-mute ko na siya, Doktora. Pero
Baka hindi nakikinig.
Pero nandito siya,
Anyway.
Doktora.
Nandito naman. Nandito daw,
Nandito
doktora.
naman siya, Doktora.
Basta nandito
Pero-
siya. Baka kumakain. Okay. Sige.
So,
Draw pa tayo? Dalawa na lang. Tapos mamaya na ulit. Sige. Kanina ba yan? Yung double?
dalawa.
Nag-ulit. Kanina rin, wala. Dr. Nazareno.
Kasi na-remove ko.
Kanina din yan. Wala siya.
Hindi na-remove. So,
Or Mary Anne Marie Ignacio.
wala siya,
Ah.
Doktora.
Andyan?
Wala po.
Wala. Okay, mamaya na lang uli. So, next. Sir Bern. So, our next speaker for the PSD Select 3 is a graduate of Doctor of Dental Medicine from the Centro Escolar University. He had his Master of Science in Dental Education at the same school, Centro Escolar University. Currently, he is an Associate Program Lecturer and Clinical Instructor in Oral Surgery Study Program, Basic Oral Surgery Preceptorship, in Bulacan and Cebu. He was the past Vice President District 2 of the Philippine Dental Association Bulacan chapter. He is currently the Executive Assistant Secretary of the Philippine Academy of Implant Dentistry. Our speaker is an active consultant of the following clinics: Blessing Dental Center Corporation at the Our Lady of Mercy Hospital, Pulilan, Bulacan; Marcelo Padilla General Hospital in Plaridel, Bulacan; and at One Smile City Dental Center in Alabang, Lucena, Lipa, and Batangas. Let's all welcome our speaker, Dr. Cromwell Gatchalian Yabut.
Thank you very much, Dr. Jamin Agra, for that generous introduction, and please let me take this opportunity to extend my gratitude to everyone, ang magigiting ng mga doktor ng ating lipunan, most especially to the President of Philippine Society of Diabetologists, Dr. Richard Elwin Fernando. My heartfelt appreciation for this opportunity. Magandang gabi po sa ating lahat. Hi, good evening everyone. So, ready na po ba tayo sa coffee natin? So, get ready and we'll be having a short and sweet lecture in regards to our dental health, okay? So, I was assigned to discuss about diabetes that concerns on dental health. To start with, I am Dr. Cromwell G. Yabut, your lecturer. My objective for this night is to let you understand the role of linking between the world of diabetes and dentistry. We should have to gain respect the referral system between the medical and the dental practitioners. And lastly, to work together to let the patient understand both the concerns to avoid further complications. So, along with it, we'll be discussing more of the definition of terms so everybody could understand little of the definitions and more of the explanations. Okay? Diabetes, dentistry, dental health or oral health, complications, oral cavity, dental caries, gingiva, periodontal structures, and periodontitis. To start with our definition of terms, diabetes. As we all know, from the Google Oxford Languages, diabetes is a disease in which the body's ability to produce or respond to the hormone insulin is impaired, resulting in abnormal metabolism of carbohydrates and elevated levels of glucose in the blood and urine. Dentistry, also known as a dental medicine or oral medicine. This is a branch of medicine that consists of the study also of diagnosis, prevention, and treatment. Okay. It is a branch of medicines that consists of the study, treatment of the disease, disorder, and conditions of the oral cavity, the mouth, commonly in the dentition, as well as the oral mucosa and of the adjacent related structures of tissues, particularly associated maxillofacial area. The field of dentistry or dental medicine includes teeth as well as other aspects of craniofacial complex, including the temporomandibular joint and other supporting muscular, lymphatics, nervous, vascular, and anatomical structure. The practitioner is called dentist. It is often also understood to subsume the now largely defunct medical specialty of stomatology, the study of the mouth and its disorder and diseases. Dental health or oral health. According to the World Health Organization, oral health is a key indicator of overall health, well-being, and quality of life. It encompasses a range of diseases and conditions that include dental caries, periodontal disease, tooth loss, oral cancer, oral manifestation of HIV infection, orodental trauma, pneuma, birth defects such as cleft lip and palate. Complication, this is the easiest and simple meaning from our Google. Circumstances that complicate some things or difficulty. Is a problem or issue. Okay. Oral cavity. The mouth consists of two regions, the vestibule and the oral cavity proper. So, in the vestibule, first part, is the area between the teeth, lips, and the cheek. Okay, this is the vestibule. Surrounded by the teeth, lip, and the cheeks. Okay. The oral cavity proper, we have to understand, is bounded at the sides and in front by the alveolar process, which contains the teeth, at the back by the isthmus of the fauces. Its roof is formed by the hard palate, and in front, and the soft palate at the back. The uvula projects downwards from the middle of the soft palate at its back. A mucous membrane. The oral mucosa lines the sides and undersurface of the tongue to the gums, and the lines the inner aspect of the jaw, is the mandible. The floor is formed by the mylohyoid muscles and is occupied mainly by the tongue. It receives secretions from the submandibular and the sublingual salivary glands. So this is the oral cavity proper. We have the hard palate and the soft palate. From the roofed area, we have the tonsils from the posterior and the posterior surface and the uvula. And we have the tongue, that area. Dental caries and carious lesions. Dental caries or carious lesion or cavities, more commonly known as tooth decay, are caused by the breakdown of the tooth enamel. This breakdown is the result of bacteria on the teeth that break down foods and produce acid that destroy tooth enamel and result in tooth decay. So here's an example of the bacteria then later form an acid. Okay. So as you can see here, if ever we eat, kunyari kumain tayo, no? We don't brush our teeth, we don't gargle, we don't wash our mouth afterwards. So those food that sets into our mouth, that stays into our mouth kasi masarap, no? So minsan ninanamnam pa natin yung food. So what happens there? They stay there inside our mouth. The problem is that when they overstay in our mouth, what happened? Siyempre, food dyan. What happened after 12 hours, 24 hours, 48 hours? Napapanis sila. Without us knowing, kala natin it's on a normal state yung food na nagstay sa loob ng bibig natin. So, mapapanis sila. Pag napanis ito, the bacteria that set in dun sa food na napanis or nag-overstay to our mouth, they produce already an acid. So, this is how they produce an acid on that surface. Well, that's the time this acid will destroy the tooth enamel. Actually, if bacteria alone, hindi niya ito masisira yung tooth enamel. Kasi the tooth enamel, as we all know, this is the hardest structure in our body, right? So the only way na mabibreak niya yung enamel is through acid. So, if food is napanis, ang drinks that we take is napanis din, they produce acid already. And this acid would destroy the enamel. Once this acid gets in, the bacteria, the secondary enemy, would get inside our teeth already. So, ganun siya pumapasok. Hindi nauna ang bacteria. Nauna ang acid before it settled down there. Then, this results in a tooth decay. So, let us see. Kita natin, ano? Minsan wala sa ibabaw yung sira ng ipin natin. Dok, maganda naman yung pasta, but later we would be seeing On the sides, pagka pinastahan na, Dok, ba't ang laki-laki ng pinastahan mo? Kasi nag-set in sila doon sa side ng ipin natin. Kung asa nagkakaroon na tayo ng tinga on the proximal sides ng ipin. Okay. Another, this is what happened. The crown of the tooth is very good, pero below the neck area of the tooth, which is on the root surface, kung saan nakatago siya doon sa loob ng gums, yun yung nagkakaroon ng sira. Okay? So this is also a dental caries or caries lesion. So what are we going to do with this kind of teeth? Some, if the nerve is not yet affected, we could still save this tooth for tooth restoration or tinatawag nating pasta. But if nerve is already damaged, so we could do a root canal treatment. But to some, what they want is to extract this tooth. Okay? So, it's a patient's options. But the best thing pa din, kung masisave namin yung teeth, it's an early detection, mas maganda. We can save the tooth. And to some of our patient that has, lalo yung may mga diabetes, it's either elevated or mababang sugar level. So this what happened to their cases. Okay? Normally, since yung salivary flow or pH level ng katawan ng tao ay abnormal or not on the usual pH level dapat, so yung saliva greatly affects to cause a dental caries formation. Okay? Ano nangyayari? They produce later on an acid, then yun, nagkakaroon din ng sira dun sa ipin natin. Even, then, bumababa din yung gilagid ng patient. Later, ano nang mangyayari? So, either we extract the tooth, everything in there, kasi later, mag-ano na yan, mag-wobble na yung mga ipin. Then, mamamaalam lang din sila. So, kung meron tayong patient na diabetes, kung meron tayong diabetic patient, better, let them visit also the dentist para at least hand in hand, malagaan namin yung ipin habang tinitreat nyo yung ating mga pasyente. Kasi, syempre, sabihin natin, saan ba nagsisimula ang digestion? Sa oral cavity. Ngayon, kung maalagaan natin ang oral cavity ng pasyente natin, what happened? Nagkakaroon ng magandang nutrition sa katawan ng pasyente. Okay? Sometimes yung magandang nutrition, definitely, nagiging maganda rin ang health ng patient natin. So, yun yung nagiging result ng magandang oral cavity at saka magandang health ng patient. What causes dental caries? What causes tooth? Here on the image, you can see si molar tumatakbo. Ayan, takbo, bilis. Yung mahabol sa atin. Well, that's the donut. So, masarap yan, di ba? So, favorite naman ng lahat yan, yung sweets. Ewan lang dun sa hindi sweet tooth. But, more likely, everyone loves sweet foods. Okay? Kasama na dyan yung mga chocolates, ice cream, soda, cokes, everything. So, natatakot si molar dahil ang question lang natin dito, paano natin maalagaan right after we take the food inside our mouth? Okay? Or during our grinding, eating, everything, chewing. Okay? Paano ba to? So, the easiest way is to gargle with water right after you eat or you drink. Okay? Dok, gusto ko pang namnamin. Yes, pwede mong namnamin. Wala namang problema. But, you have to know that pag kumain tayo, may physiologic response eh. Pag tumatagal na to ng 3 hours, 6 hours, 12 hours, 24 hours, 2 days, what happened? Yung physiologic response, nagkakaroon ng acid formation. Okay, bakit? Yung food that we eat, the drinks that we take, nangyayari dito, napapanis na sila. So, lumalasa na din, di ba? So, dumidikit lalo sila dun sa surface ng ipin natin at saka dun sa cervical surfaces ng gilagid natin. So, well, that's a time na nagpo-form na sila ng acid formation. So, before that happen, mas maganda, pagkakain, namnam ng konti, but we have to take care of the teeth kung gusto nating tumagal yung ating mga ipin. For those with dentures naman, ganun din. You just have to wash that dentures once every after eating. You just have to go for the restroom, clean that dentures, or gargle with water, or gargle with your mouthwashes. So here we have the stages of dental caries development. Initially, there is an enamel caries, then develop to dentine caries, then later pulpitis and periodontitis. Okay. Sa enamel caries, normally what we see there is just a spot. Okay, yan katulad nito, tuldok lang to eh. Tuldok lang yan. You don't have to worry. No? Hindi ko mo napapacheck to kasi wala namang masakit. But, mas maganda, mapacheck up na natin siya. Ngayon, kung malalim na yan or nagsisimula pa lang, prevention is still best than cure or treatment. Okay? So, minsan pagpunta nyo sa dentist, yun pala nag-take effect na. Bumaba na yung dental caries to the dentine surface. Hindi pa din natin pinansin dahil tuldok pa lang din siya. Okay. So, nag-progress for a few months, few years, naapektuhan na yung nerve. So, the nerve, which is the pulp, yan, nagkaroon na ng pulpitis, inflamed na yung nerve. Dok, masakit na mangilo, pero I'll take only anti-inflammatory or pain reliever. Later, what happened? Patay na si nerve. So, what are we going to do? We're going to do a root canal treatment with this one. Kaya lang, pagka hindi yung pinagamot, definitely there would be a periapical abscess that would go into the fibers or the periodontal surface of your alveolar bone. Okay? So, ano bang gusto natin? Mapilayan pa yung ipin natin, masira yung ipin natin, mabunot, maging weak, or we just have to visit our dentist para ma-save natin ito. Gingiva. Ano bang gingiva? The healthy gingiva is commonly described as salmon or coral pink in color. Okay? It may be pigmented, which reflects the ethnic origin. Here, the gingiva is firm in consistency and firmly attached to the underlying alveolar bone. Kita natin, di ba? The surface of gingiva is keratinized and may exhibit the orange peel appearance. We called it the stippling. Yung sa orange, di ba? Parang may mga tuldok-tuldok. Dapat ganun yung appearance nung wag lang yung may lalim-lalim pag ganun. Parang meron lang siyang tuldok pagka tiningnan natin siya sa appearance nung ilagid ng mga patient natin. Okay? So, ito yung favorite na ginagawa ng bawat isa. Sino po ba dito ang mga nagpo-floss? Okay, very good and honest yung mga doctors natin. Okay. Actually, I am not an advocate of flossing, no? But I do flossing. Once in a while, I'll do flossing. Anong dahilan? Okay. Pagka may sumabit na meat, or the fibers of the meat that gets in contact with the proximal ng mga tooth natin, hindi matanggal, well, that's the only time I do my flossing. Okay, bakit? What happen if we do a regular flossing? Ito, nagbi-bleed, diba? Nakikita nyo, nagdudugo yung once na nag-floss kayo, nagdudugo. Dapat lang yan, parang pagka nag-floss tayo, dadaan lang, just a snap, then remove na. Snap, then remove. Not to do, parang kinakaskas natin dun sa tooth. Okay? We are breaking already the fibers that connect the tooth and the bone. Kaya ito nagbi-bleed. Kasi ang problema natin as an individual, the rationale or example is yung lamok. Kinagat tayo ng lamok sa kamay natin. Okay? What are we going to do? Initially, we tap, then later, we scratch. Okay? Okay lang kung isang scratch lang, kaya lang kasi nag-enjoy tayong mag-scratch. Then later, what will happen? kakaroon na ng sugat dahil nag-enjoy tayo sa scratch na yun. And we are satisfying also ourselves dahil dun sa pagkakamot natin. Okay? Hindi natin alam, sugat na, dumudugo na. So, we enjoy. Same goes dun sa ating gilagi. Kasi nag-enjoy tayo habang nagpo-floss tayo. Hindi natin nararamdaman, hindi natin alam, napuputol na pala yung fibers that connect the tooth and the alveolar bone. So, yung fibers na yun, napuputol na natin. So, it bleeds, and later on, bumababa na yung gilagid natin. Dok, ba't dumudugo yung gilagid? Naputol nga natin yung fibers eh. So, what happened? Yan o, diba? Mababa na yung gilagid natin. Pero, malinis pa nga yung ipin. If you'll see, may stain lang. Pero, ganun pa man, magugulat tayo ba't wala ng fibers? Wala na gaano nag-hold dun sa... Is it reversible? No. It's not reversible. It's irreversible once you cut the fibers. Dok, paano ito? So, what we can do for this one, to some, what we do scaling for this one, then later, we do a surgical management, which is grafting. But, it doesn't guarantee. Kasi, hindi naman nakakapit ang fibers on these two. Yes, tatagal naman yung grafting materials natin, but, definitely, wala namang fibers nakakapit eh. So, we'll just wait and see for its an integration between the tooth and the bone graft that we put into your gingiva or to your gums. Here, on the other side, if you could see here, on this side here, this is a healthy surface, okay? Dito sa kabilang side na to, this is a surface wherein we do flossing. We traumatize the gums and the tooth. Sinasabi ko nga sa pasyente, ang toothbrush po para sa tooth, hindi para sa gums. So, yung iba, ang pinabrush nila is gums. So, dapat gum brush. So, ang kailangan natin gawin, yung toothbrush sa tooth lang. Okay? Yung malapit sa neck ng tooth and the gums, pabayaan nyo na po yung dentist doon para ma-save namin yung gums ninyo. Kayo din po para ma-save po ninyo yung gums ninyo. So, Dok, paano yun? Gusto kong matanggal yung nandun sa cervical area or malapit dun sa neck. Pwede naman yun. You could use the cotton buds to clean that surface. Pero below that surface, it's so sensitive na dapat si dentist professional treatment yung kailangan gawin po doon. Okay? So, pagka na-break natin yung fibers that holds the bone and the cementum or the part of the tooth, is what happens. Nagkakaroon ng opening. Once this happens, the plaque or the food debris stays on that area, then little by little, the bacteria would destroy that binds that together, yung the tooth and the bone. Yung fibers, little by little, yun madaling masira eh. Madaling sirain yun ng bacteria. But, if we can control that part, then masisave natin and it could go back into a healthy gums and healthy teeth. So, here is a little of explanation. We have here the fibers, okay? On this side here, yung violet tsaka yung black, this is the fibers. Periodontal fiber. We call it the periodontal fibers. And we also call this as our shock absorber. So, magnify natin ng konti. Okay? So, here on the side, this is the fibers. Once you break it, it's irreversible. So, anong nangyayari dito, floss tayo, nag-enjoy tayo, nasa-satisfy tayo dun sa part na yun. Then, later, hindi natin alam, bumababa na pala yung gums natin. Kasi pag wala nang hawakan si fibers, definitely si bone, bababa na din. Pero hanggat nandun si fiber nakadikit sa tooth, si bone ay nakadikit naman din dun sa kanyang fiber, definitely, meron pa silang function. So, di ba, anything na nawawala ng function, nangyayari, lumiliit. So, we have to remember that. Okay, this is what happened. Okay. Hindi natin naalagaan. So, food debris, food entrapment, tartar, calcular deposit, stays there already. Later, pwede na din magkaroon ng dental caries or masira yung ipin natin on that side. So, periodontal structures. Ano ba tong periodontal structures? This involves the gums, the cementum, the alveolar bone, and the periodontal ligament. Periodontal ligament is a fiber. At the same time, you can call this the shock absorber of the tooth. Okay. Periodontitis. Periodontitis is a severe gum infection that can lead to tooth loss and other serious health complication. Yan, pagka hindi natin ilagaan yung ipin natin. Katulad ng pinakita natin kanina, di ba? So, mababa na nga siya, madumi na siya, meron na siyang calcular deposit, may food debris na siya, kaya na nag-gargle tayo, hindi mo pa din pasyal yung ating mga pasyente sa dentist. So, what happened? Lumalala yung problema ng patient. Okay? Kahit sabihin natin na problema ng pasyente yan about the oral health niya, basta ako problema ko is diabetes. Okay? Pag hindi din inalagaan ng pasyente yung kanyang oral cavity, what happened? Bumabagsak din ang health ng pasyente. Dahil yung nutrition, magsisimula parati sa digestion. Digestion, okay? Sa oral cavity. Periodontitis is also called gum disease. This is a serious gum infection that damages the soft tissue and without treatment can be destroyed the bone that surrounds or supports our teeth. Okay? So this is the normal tooth. Okay? Pagka normal tooth, ano nangyayari? Ibig sabihin ng normal tooth, healthy tooth, healthy gums. Okay? Pati yung bone level, if you could consider the bone level. Oh. So, maganda. Tapos, the crown portion or the upper portion, very healthy. You can see it, di ba? Naka-close or yung walang gap from this side. But, once hindi tayo nakakapagpa-check up sa dentist, even our patient, lalo yung mga diabetic patient natin, dun pa naman, syempre, mas mabilis ang infection or bacterial formation sa loob ng bibig ng pasyente. So, it deepens that surface. The gums inflamed, the bone inflamed, so everything inflamed. So, bumababa yung bone natin that holds the fibers that holds also dun sa tooth natin. Later, karamihan ng mga pasyente namin na nire-refer po dun sa clinic namin, lalo yung may mga diabetes, puro late na eh. So, what we can do is we'll just do the extraction for this patient instead na we can still save this patient. Save the tooth of this patient. Okay. So, ito pa lang po yung lecture proper natin. Okay? So, this is the common dental problems in diabetes mellitus patient. So, 3 of the most common dental concerns that these diabetes mellitus patients may have or may develop in the long run, 1 is periodontal diseases. Number 2, salivary gland dysfunction. So, ito yung pangalawa sa pinoproblema ng bawat dentista. Pagka nagkaroon ng dysfunction sa salivary gland, definitely, ito na ang simula ng problema namin ng mga dentist. Okay? Another, ito ang problema ng lahat. Okay? Poor wound healing, lalo sa diabetic patients na. So, start with the periodontal disease. It is mainly the outcome of the inflammation or infection of the tissue surrounding and supporting each and every tooth inside the oral cavity. So, causes poor to neglected oral hygiene, causing build-up of tartar. So, pagka meron na tayo nararamdaman na nagbi-build up ng tartar, or hindi pa man, you have to visit the dentist. Okay? Or else, there would be a severe and deep penetrating calcular deposit. Normally, ang binibigay kasi sa atin ng daily recommended ng mga dentist, no, at least once a year. Pero, in our practice, in my practice, pagka merong compromised si patient, nasa-shorten yung period of monitoring namin. So normally we do at initials either every 2 months or 3 months. Para before mag-progress yung development of periodontal diseases, lalo na pagka-diabetic patient ito, naalagaan namin yung gilagid, the bone, and the teeth of the patient para hindi siya magkaroon ng severe problem later on. Okay. Then, what are these causes? To some, these patients taking some medications like phenytoin, cyclosporine, anticonvulsant drugs, immunosuppressant drugs, and most of the calcium channel blockers. So, Doc, nakaka-apekto pala. Yes, nakaka-apekto itong mga gamot na ito. And you have to take note on this. Siguro kahit anong drugs naman, anong medicine, even if it's not diabetes patient, once they're taking any kind of medicine, there would be an alterations of hormones or pH level of the patient. Okay. In diabetes mellitus cases, periodontal diseases develops aside from the above-mentioned causes secondarily due to impaired immunity. Another, there is a poor healing factors. So dito, tingnan natin. Oh no, this is dilantin sodium. So once this is taken by the patient, what happens is that normally there's an hyperplastic tissues that reacts to our gingiva, to the gums. Doc, ano po ba ito? This is deadly. No. It is the normal reaction of a drug-induced medication to the oral cavity or the soft tissues in the mouth. So, may treatment pa ba dito? If it doesn't, kung hindi naman to nakakasagabal sa pagkain ng patient, then there's no problem on removing it. Okay, but if this already becomes problem on the digestion, on eating the patient, what we can do here is we do a gingivectomy or we cut this hyperplastic tissues. The question next is that is this one recur or it recurs? Yes, it will recur. So paano gagawin? Ganun din po. We'll just have to do cut from these gums, then monitor and observe. Okay? So, aalagaan lang natin talaga. Ngayon, ang magiging problema lang naman natin dito ay kung hindi natin naaalagaan at namomonitor ang ipin. Ano nangyayari? Nagkakaroon ng bacteria inside the periodontal structure. So, nagiging doble ang problema ng dentist dito. So, later, pag hindi siya naalagaan, baka ma-remove pa yung tooth. So, these are severe form of drug-induced. Okay? So, we will just have to remove these hyperplastic tissues. Yun nga lang, when we remove hyperplastic tissues, it doesn't stop from that. We have to do a tissue sampling or biopsy for this one. Okay? Yan pa siya. Dami, no? So, as you can see here, papansin natin, di ba, there's a tooth there. Ayan, may ipin tayo dito, di ba? Yun. So, nagkaroon ng movement dito dahil hindi naalagaan. Okay? So, yun. We have to remove the tooth kasi it would cause infection already. But, if not, kung maayos naman siya at maganda pa din yung kapit ng bone, ng fibers dun sa ipin, we don't have to do anything from that. Bawal ba ang smoking? Yes, bawal ang smoking as possible kasi it would also induce. Okay? Ito, it's a combination of hyperplastic and periodontal problem. So, periodontitis ka na, meron ka pang hyperplastic tissue. Mapapansin natin na yan, no? May nanganganak pa, di ba? So, may periodontitis na din si patient dito. Later, mari-remove na din ang ipin ni patient. So here, ano ba yung nakikita nating sore spots dyan? Sino ba ang nagtutoothbrush kasama ang gums? So this what happens, no? Natutoothbrush natin yung gums. Okay, tapos pupunta tawag sa dentist. Dok, dumudugo yung gilagid namin. Dumudugo yung ipin namin. Yung pala, ang tinoothbrush, when we look at it, toothbrush yung gums. Okay. So going back on this is also drug-induced hyperplastic or periodontitis. So this is another example of hyperplastic tissue, drug-induced. Okay, for the calcium channel blockers. So there's also gingival overgrowth for hypertensive patients. Okay. So one, periodontal diseases. Therefore, they can develop this disease more rapidly and more severely, thus placing their periodontal health at far greater risk than patients without diabetes. Symptoms for this one is gingival bleeding, gingival swelling, and gingival pain. So, going back muna with these issues, si patient, nagkakaroon lang kami ng problema as a dentist, no, that would attend to your patient. Normally, kung hindi balance or hindi naka-normal yung kanilang sugar level. So, yun yung nagiging problema namin. Meron na nga silang periodontal diseases. At the same time, hindi pa balanse or hindi pa normal yung kanilang mga results from their blood sugar levels. Okay? So, yun yung mga nagiging problema namin. Kaya, instead na gumagaling sila kaagad, kahit sabihin natin, o dadaan ka lang sa oral prophylaxis, dental cleaning, pero later, mapapansin natin, ba't hindi gumagaling yung sugat ni patient? So, normally, pagka ganoon, yung napapansin namin sa mga patient namin, lalo when they visit our clinic, dito sa hospital sa Pulilan, we normally refer them to our diabetologist, kay Dr. Marcy Cruz, para ma-attend kagad. Then later, once cleared, mapapansin namin at makikita din ni Dr. Marcy kasi magkakaroon ng thorough evaluation. Si patient pala ay diabetic. Okay? So in that way, sabi namin kay patient, hindi kagad pwedeng diretso for the treatment. Okay? You have to take the medicine, everything should be back into normal, or kung hindi man back into normal, at least you're taking the medicine already, then we can do the dental treatment. So, pagka ganun po yung nangyayari, nagkakaroon ng magandang treatment kay patient. When we do kahit oral prophylaxis lang, no? Kasi when we do oral prophylaxis, definitely, magkakaroon siya ng konting sugat, kaya nagkakaroon ng bleeding. Because we have to remove an irregular shape calcular deposit that stays into your teeth na nakadikit din siya doon sa gilagid. So, konting cut nun, so sobrang sharp ng tartar or calcular deposit, nagkakaroon ng sugat yung ating gilagid. So, dapat, when we do that procedure, patient should be in at least close to normal dun sa kanyang blood sugar levels. Okay? So, what are the symptoms here? Gingival bleeding, gingival swelling, and gingival pain. Okay? So, here, if we have these symptoms, we must attend properly so as to prevent further possible problems and complications. Having said such concerns, they must be closely monitored by their dentist. Hindi siya pwede yung, okay, balik ka na lang sa akin after 6 months, tsaka pagka okay ka na. Hindi. Pagka may periodontal disease si patient, it should be as much as possible close monitoring. Normal lang, ginagawa namin dito every week hanggang makontrol namin yung medyo maging, hindi man mag-normalize 100% yung gilagid, pero at least a very good development of the gums na hindi na siya gana mag-bleed or magkakaroon ng yung color na pinag-usapan natin kanina, di ba? Salmon pink, dapat close to that color na. And if these cases come across to your practice, kindly refer them accordingly. You move in. This is the periodontal disease. So what happened? Siyempre, inflamed. So once this is inflamed, what happened? Diba konting kanti mo lang sa inflamed tissues, nagbi-bleed na. At the same time, there be a little pain. Bleeding tendency occur. So, to some of the patient that sabihin natin na, look, I normally go to the clinic naman I regularly regularly and religiously go to dentist every 6 months or a year time. Regular po ako every 6 months. But, the treatment for this one, since may periodontal disease ka na, hindi siya pang 6 months. It should be monitored closely. Okay? Lalo kasi, there's an imbalance of your hormones or your sugar level. So, dapat mas closely monitor tayo. Para at least, before things develop, katulad nito, mapapansin natin, nagkakaroon ng deposit, kahit ayaw natin magkaroon ng deposits on the surface, so nagkakaroon ng deposit, and later, tulad nito, nagsisimula na din magkaroon ng resorption, bumababa na yung ilagid, so it should be treated with the right and professional treatment by our dentist. Salivary gland dysfunction is one of the 3 most common dental concerns. So, there are certain changes that happens in the salivary status, okay, of diabetes mellitus patient. Most commonly seen for this are some are cases having dry mouth or xerostomia, causing less production of salivary flow, making them more prone to develop dental problem. But not all diabetes mellitus cases can suffer from this. Only those with uncontrolled diabetes. Okay? We have sample for this one. Okay? If you have a dry mouth, what happened? On a healthy, mapapansin natin, very smooth yung tongue surface ng patient. But if there's a dry mouth, pansin natin dun sa kabila, meron mga crack. Kala natin crack lips lang ang meron, no? Even din sa crack sa tongue natin, meron tayong crack surface ng tongue natin. Another, ayan, on a severe form. Okay. Normally, etong dry mouth or xerostomia, dapat i-consider ko lang to dun sa mga adult patient natin, yung talagang medyo konti na lang yung hydration sa katawan. Okay? Pero, even in a younger age, yun nga lang, kung si patient ay merong diabetes, this also happens to them. Nagkakaroon ng dry mouth, nagkakaroon ng xerostomia, their tongues are nagkakaroon ng geographic tongue. So, this one, no, crack yung tongue, no? So, later, pagka-crack yung tongue natin, dry yung mouth natin, maapektuhan na yung, in general, yung loob ng bibig natin. The tooth are affected. Okay? So, little by little, nagkakaroon na din ng periodontal problem. Okay? This one here, hindi to nag-smoke, but this patient here, definitely, because of, not because of smoking, okay? Because of dry mouth, ito na yung nangyayari. Little by little, wala ng hydration, so mapapansin natin, periodontal structures are affected, even if you brush a lot. Yung calcular or tartar deposit, dumadami din sila. Okay? So, anything na magkakaroon ng variation or pagbabago sa katawan natin, or pagbabago sa loob ng body natin, nagtitake effect siya initially sa loob ng bibig. Okay? Kung nilalagnat nga tayo, di ba, makikita natin, sa bibig pa din. Kasi nagkakaroon ng mga soreness or ulcerations. This part here, ito na yung nangyayari. Okay? Later, what will happen? Yan. Magwo-wobble na or gagalaw na yung mga ipin natin. Magmo-move na sila. Later, bubunutin na lang yung ipin natin. Salivary gland dysfunction pa din tayo. In an article published by Kelly Wood in February 2021, he mentioned that according to the National Institute of Diabetes and Digestive and Kidney Disease (NITDK), it could be possibly due to dehydration, increased blood sugar levels, kidney condition, and diabetes medication. Seemingly, some cases in xerostomia may present fungal infection called thrush, which is also painful and may cause foul odor. Again, this is due to poor salivary flow. Okay? Pwede palang mangyari, no, na magkakaroon ng oral thrush. So, si dentist, alam natin ito, pagka nagkakaroon ng dryness of the mouth, normally, kasunod na nito, fungal infection. So, once na magkaroon ng fungal infection, this is what happen. Nagkakaroon ng thicker viscosity sa loob ng bibig natin. Okay? Thicker viscosity yan siya. Another, there could be an oral thrush on the sides of your tongue. Okay? Kasi, kakaroon na nga ng dryness of the mouth, then, left untreated pa siya. It is observed to these individuals to have a lower poor status of immune system. Okay? So, poor wound healing. Some patients may present slower healing process, lalo na pagka uncontrolled diabetes mellitus. Others may have non-healing cases. Yun yung pinakamabigat eh. Pagka non-healing cases. Okay? Wherein all we know that it poses greater risk and severity of complication may usually arise. Okay? Okay, in poor wound healing, we have a contributory factors that would be, one is the high level of blood sugar, neuropathy, poor circulation, immune system deficiency, infection. So these 5 are the contributory factors that would affect a poor wound healing for our diabetic patients. Okay, so here, in my case, I can relate as a dental surgeon, and so most of our referral cases with diabetic mellitus patients requiring the dental surgery or periodontal treatment, they must secure a thorough medical evaluation and clearance from their diabetologist. It is a must that I carry a strict protocol for doing any dental procedure. Kahit po ano ito, cleaning, okay, and restoration. Kasi we never know kung, kahit sabihin natin maingat tayo, no? We never know if part of the tongue would catch on that surface or yung drills namin would be moving along the gum area. So, any dental procedure, dapat we have to request for the clearance for the diabetologist. Okay? Though sabihin natin, hindi naman kayo magsisurgery, but the cleaning itself, the restoration itself, at least kung alam ng dentist po ito, maalagaan din namin yung patient na i-refer ninyo sa amin. So, we could work hand in hand for this matter. So, before the development of infection, maalagaan na natin kagad. So, prevention pa din. Okay? Para kung sakaling magkaroon ng wound on that surface, the healing process is very fast for this kind of it. This also implies to the patient's strict compliance to their medication. So, dapat, kung manggagaling din sa ating mga diabetologist yung ating mga pasyente, kung galing na sila sa inyo, and we will be more confident on treating this patient. Unang-una, if they take the medicine at na-educate na din natin siya about their regular diet, their lifestyle. So, mape-prevent na natin yung serious problems that would come up later on. Furthermore, their inability to process proper wound repair, yun yung talagang problema natin sa mga diabetic patient. Wound healing would affect not just their dental health, but their overall physical condition. So here, what I'm telling lang naman dito sa atin between the dentist and the diabetologist, we should work hand in hand in treating your patient, our patient, para at least maging maganda, and we can prevent further or serious problem that would arise both in the oral cavity and the totality of well-being of the patient. Okay, poor wound healing. Okay, like this one, the poor wound healing is that On this case, ito, ONJ, or we call it the osteonecrosis of the jaw. Normally, this part here, yung jaw natin, lalo pagka meron siyang, it's a combination of problems or case or complications na nag-arise na dito sa patient. No? The patient underwent cancer treatment. Another, the patient is diabetic. In cardio, may problema si patient, hypertensive si patient. So, all these four specialties came up and we help each other para ma-treat itong patient na to. Okay? So, with the poor wound healing, na-balance yung una, yung kanyang sugar level na balance. Ano? Once this one is balanced already, kahit sabihin natin necrotic na yung surface ng bone, the worst part of necrotic part of the bone, we already see some of them, meron na, yung iba na, sorry for the term, yung iba inuuod na yung mga necrotic bone when we remove part of the necrotic bone. Another is that, wala na tong pakiramdam talaga. It's parang, ang itsura po niya is parang corals na natuyo. So, we just take co-manage with the cancer doctor, with a diabetologist. Diabetologist played a very big part on this one kasi binabalanse niya talaga parati yung kanyang sugar level. So it came into a 2-year time and it's a success for the treatment. Automatically nag-move out lang yung when we do the last surgery with this patient, talagang when we remove it, naghiwalay na yung vital structure ng alveolar bone from the necrotic bone. And we close the gap. And when we do the surgical management for this one, maganda na itsura nung alveolar surface nung patient natin. Okay? So, wound healing would take place for this kind of cases. Katagal nga lang po. Dapat close monitoring ng dental surgeon or dentist. Okay. It's another one. So, if it's a non-healing, it should be evaluated well. It should be checked well by our dentist. Okay. Actually, ano naman po yan, it's a co-manage. Kung talagang may nakikita kaming non-healing on the surface, then the medical doctor, we already call the attention of the medical doctor to help us out in controlling also their comorbidity. Well, this is me and my beautiful wife. She's also a dentist. She practiced special child pediatric dentistry. Tumakas po kami nito this last few months, going to Baguio to visit our baby branch. Okay. And takas din po ito with the whole family going to one of the coffee shops at Mexico, Pampanga. Don't worry. Wala pong tao dito. Walang ganun tao. Kami lang po ang tao dito. At saka yung nagtitinda. Okay? Then, another takas with the whole family. We do a check-in at Taytay. Introduce to you our baby boy. This is a precious baby boy. He's an adopted child, okay? Then, good thing about this child is that in spite of his disabilities, ang disability po niya ay hydranencephaly, he still survives for a 4-year right now. And we always pray na maging healthy itong baby boy namin na ito, okay? And this is me, wife, this is Matty Boy, and our beautiful daughter, Ate Iyay. Let me introduce to you Matty Stefanik. Again, to wrap up this lecture, let me share this saying by Matty Stefanik, the late American child poet, and he's died at an early age of 13. As he quote, "Unity is strength when there is teamwork and collaboration. Wonderful things can be achieved." May close this with a simple prayer of good health and better life for everyone. Thank you, everyone. In advance, Merry Christmas to everybody. Good night. That's all, folks.
Thank you, Dr. Yabot, for the very educational lecture. Dami ko pong natutunan na maling way of cleaning my teeth. Thank you, Doc. So, Doc, we have here some questions for you from the chat box. The first is, what is the reason why does calcium channel blocker cause periodontal disease? Doc, nakamute ka po. Lynn? Nakamute si Doc. Lynn, pa-unmute kaya. Sir Bern? Sir Bern, nakamute si Doc.
Yeah, Doktora, he can unmute na po, Doktora.
Sir, I think nakamute kayo.
So, Dr. Yabot, you can unmute yourself now.
Hello.
Yeah.
Hi. Can you hear me na po?
Yes, sir.
Yeah. Thank you very much, and hope meron pa tayong natutunan dun sa small and sweet lecture natin sa dental, from the dental side. So from the first question, no, regarding sa calcium channel blockers, ang main problem namin as from the dentist to have it, yung pinaka-problem natin dyan sa patient that's taking calcium channel blockers. Normally, patient, nagkakaroon po itong dry mouth. Kaya nagkakaroon pa din ng changes inside the salivary flow ng oral cavity ng patient that is taking calcium channel blockers. Then, dun sa severities naman nito, ang nagiging problema natin, these cause gingival swelling, inflammation primarily due to connective tissue response. There's an excessive accumulation of extracellular matrix proteins onto the gingiva po ng patient natin. Kaya siya nagkakaroon ng mga initially periodontitis. Kaya nga ang maganda dito sa cases natin with the patient that is taking regularly calcium channel blockers na medicine, they have to visit the dentist para before anything else would happen or magkaroon ng severity dun sa kanilang gingiva or periodontal structures, dun sa kanilang ipin at gilagid, ay na-evaluate further na din po nung dentist natin at na-monitor, nalilinis lalo yung kanilang periodontal structures, lalo yung kanilang ipin at yung kanilang gilagid po. Then, we could also give an advice for this kind of patient na papasyal po sa amin, sa dentist, na in terms of their mouthwash, regular maintenance, in their home medications din po. Yun po. Hope I answer it right po.
Okay, thank you, Doc. Doc, here's another question from Mama Grace. How many
Yes.
of our patients suffered from dry mouth? How will you manage salivary gland dysfunction?
That's a very good question, Doctora. In management of the salivary gland dysfunction, initially, what we do with the patient, we check further. We do a further evaluation for the patient, initially with their age. Kasi baka mamaya tinitingnan natin yung age pala ng patient natin is already on the 80s, 70s. Definitely, they are dehydrated already. Yun pala wala silang diabetes, right? So, we just have to give them and advise them that you have to take plenty of fluids and take lots of water into your body. But to the younger age na patient natin, lalo nagkakaroon sila ng problema on their salivary dysfunction. Initially, in consideration dun sa ating mga patients with diabetes, katulad nga ng na-discuss din ni Dr. Rima kanina, maganda ma-check din ito or we do a referral to our diabetologist to check further una yung kanilang medical health and sugar levels. Ngayon, if this doesn't fit on that they don't have any problems on their diabetes or in anything. What we do here is that we do a co-management with our ENTs. So they are also best to work with this with us, the ENTs, and check also their yung mga salivary problem. Baka mamaya meron lang itong mga stones on doon sa mga glands nila, sa mga ducts. So what we do, we co-manage this with the ENTs and our radiologists, and we do some cyanogram examination with the patient. Ngayon doon makikita namin if there is a stone inside the ducts or in the glands, at least that's the initial step that we could do pagka nagkakaroon ng salivary gland dysfunction. But if it really having problem already on their medical, then it's a co-management between an ENTs and another specialist to work with us para po makontrol po ito. But more so, the regular or home treatment for our patient, the initial or the easiest way to tell your patient is that you have to take plenty of water. Another is that ang ina-advise namin, you have to, kung okay lang sa kanila, to induce yourself with yung mga maasim nating pagkain like mangga. Di ba minsan tinitingnan pa lang natin yung mangga, nag-aasim na tayo, then naglalaway na din yung mga patient. Like those kind of fruits or food, makakatulong ito dun sa pag-induce ng saliva din natin. Okay? And it also differs kung meron tayong, to some of the patient kasi natural tooth eh. And to some of the patient, they are wearing a denture. So that's the problem between that. Magkaiba yung problema nung merong denture tsaka yung walang denture. Sa may denture, normally, nagkakaroon talaga dito ng dry mouth. Okay? Ang hirap kasi dun sa complete denture or dun sa may denture, ang nagiging problema natin dito, wala talaga yung, or mabawas yung ating paglalaway dun sa loob ng bibig natin. So what we advise then, since complete denture na, no, we advise the patient, you have to take some of the candies, not just to support the dentist, okay? Kasi yung lagkit, every time we eat the candies, ano nangyayari? We produce lots of saliva, right? So makakatulong din ito. Okay? Yun po, Doktora.
Sir, there's a lot of question here.
Yes, it's okay.
What can you do if the tooth jacket, the one that causes the cracking of the tongue?
Okay, that's another story there. Okay, it's a different story between problem with the salivary gland flow versus the crack due to the crowns. Okay, if the crack is due to the crown, what we can do there is that initially you have to visit your dentist. Okay, ibig sabihin hindi na siya fitted yung crown ninyo dun sa surface ng gilagid natin. Kasi nakakaano na siya, nakaka-traumatize na siya. At the same time, definitely every time we talk, gagasgas at gagasgas yan. And it will not be good. Kasi pagka nag-crack na yung surface natin, the worst part of it that we have visited in the clinic with us, nag-slice na yung pinakagilagid nag-slice na yung pinakatang. So parang dalawa na yung tang ni patient, meron siyang maliit na tang. So either we have to cut the side of the tongue or repair it. Kaya lang minsan pag ni-repair at wala ng blood supply, baliwala din. So just have to cut that surface. Best way is to replace the crown. Visit the dentist and have an advice for the dentist pero best pa din is to replace a new crowns for that one. Okay?
Okay, sir. So here a question from the PSD President, Dr. Fernando. Can receding gum be reversed? And what is your take on whitening preparation for stained teeth? Like drinking coffee, as follow-up question by Dr. Rima.
So, at first, ang problema natin dito ay going back is
Receding gum.
first receding gums. Kung reversible ba yung receding gums? Normally sa receding gums, we'll just hope and pray na gumaling ito. Ang target namin as a dentist dito at ang take namin dito as a dentist, what you could do, visit the dentist first. Let the whole surface be clean. Kailangan lang namin ma-clean muna ito eh. If this could be reversible, then that's something very good. Pero kung medyo late na yung visit nyo sa dentist at talagang mababa na siya, that becomes a problem. Okay? Hindi na namin siya maitataas pabalik. From the lecture before that I have done or I've talked with, once the gingiva or once the fibers that holds the gums and the tooth is cut, it's irreversible already. What we can do for the treatment is that we just have to do some plastic surgeries or cosmetic surgeries or gingival extensions for this tooth. So magagawa pa din siya. Kaya lang, kung reversible, hindi na siguro siya magre-reverse. But the best thing, what will happen on that gums once it's already seen by the dentist, it's cleaned thoroughly and evaluated well by the dentist. At least, ang maganda lang dito, wala na yung swollen gums, wala na din yung infected gums, wala na din tayong bleeding gums. So, best thing lang dito is to clean that surface, or we could do also a soft tissue repair for that gums. Okay. Then, moving forward for the stained teeth, and plus the coffee stain of the teeth.
Because we doctors are coffee drinker. Keep us away.
Hindi ko pa papatanggal sa inyo yung coffee kasi ako din po ang dugo ko na po yata ay coffee. So, what's good with the coffee is that it really wakes us up. Okay, we keep us always awake, alert and everything. And siguro yun na po talaga yung dugo natin dito, no? So, coffee really stains a lot. The cola also stains a lot. Ano ba yung nagpapastain doon? Yung lagkit ng coffee. Okay? Yun yung sinasabi natin kanina na ninanamnam natin yung coffee after we drink. Gusto natin nandun pa yung aftertaste ng coffee. So the longer it takes, dumidikit siya dun sa surface ng ipin natin. Okay? The coffee really stains. Okay? All colored drinks stain. So that's it. But the good thing about the coffee, the good thing about the colas, the cokes, everything, it could be still cleaned by the dentist. Okay? Natatanggal po yun. And the bleaching method, ito yung question natin. Doc, nagpa-bleach ako. Bakit na-bleach ako during that day lang? Okay? We have to understand that there is a two major parts of the tooth. Okay? Pwede kasing we have the enamel surface. The first layer of the tooth is the enamel. The second layer is the dentine. Okay. The first layer, ang problema natin dyan, the first layer is the hardest structure. It's the dense structure. So, anything on that surface of the enamel, ang nangyayari po doon, kung may stain tayo doon, natatanggal niya yung outermost stain surface. Okay. Ngayon, kung nagpa-bleach tayo, Dok, bakit during the first day lang? So, magre-rehydrate kasi siya. Ngayon, kung magpapa-bleach tayo, it should reach up to the second layer of the teeth, which is the dentine. Dok, mangilo ba yun? Yes, mangilo na po pagdating doon sa second layer ng teeth natin. Depende kasi po ito parati doon sa first layer. Kung manipis ang first layer ng teeth nyo, which is the enamel, puputi siya kagad. Pero, since lalo tayong mga medyo nasa age na ng 30s, 40s pataas, so yung surface ng enamel natin talagang inalagaan ng nanay natin eh. So makapal na makapal po yun. So to get into the whiter teeth talaga, you have to bleach it na umabot doon sa dentine. Okay? Ang problema lang, Doc, kakayanin pa ba yun? Yung speech. Pag hindi po siya kinaya, there's another option that we call. We call it the crown restoration or the veneer restoration. Okay? Kasi baka mamaya, we are targeting yung kulang na lang ay yung, nakikita niyo po ba yung background ko? It's a chalky white already, right? So some of the patients, they want a chalky white. So to some, they want it lighter lang. No? Kung lighter lang, we could just visit the dentist regularly and do regular cleaning and stain removal. Yun po yung maganda din sa dentist. Ngayon naman, to add up po dun sa ating bleaching material. Meron tayo sa market ngayon na mga whitening toothpaste, right? Ang ginagawa natin dun sa whitening toothpaste is that we have to brush it only, okay? They didn't tell us na dapat nakababad pala yung whitening toothpaste natin for about 15 to 20 minutes time. So how many seconds you brush your teeth? Minsan wala pang 1 minute. Tapos na. So how will the chemicals will take effect inside the tooth, right? So maganda doon, after you brush, that's whitening pa, no? Just put something on your finger, pea size, place it there, let it stay for 10 to 15 minutes after you brush, then let it stay there. Makikita natin there would be a very good effect. Kasi kailangan mag-react ng chemical doon sa teeth natin. Does it take effect also on the gums? No. Wala po magiging problema doon sa gums. It's controlled. Don't worry. It will have its effect only on the teeth. Okay. After that, you could already gargle. Then, that's it. Every night you can do that. Makakaputi po yan. Makakatulong yan. No brand. No brand. That's the mildest and the lightest way that you could whiten your teeth. Yun nga lang, you have to visit first your dentist. Ha? Have it a professional cleaning. Okay?
Okay.
Yun pa,
Doc,
Doctor.
how about those toothpaste having the baking soda and others merong charcoal? Totoo ba
Oh,
yun?
no.
Iba
Okay.
yung charcoal.
That's been popular right now, no? Lalo yung charcoal and the baking soda. So, if you try to look on the baking soda and you try to look on the charcoal, nakakaputi naman sila ng ipin. But this the but and the greater risk on this surface. Okay, the baking soda, if you try to look on it, palitin natin or palakihin natin yung baking soda. Siya yung tinatawag nating finer granules ng papel dilihan natin. Right? Same thing with the charcoal toothpaste right now. Siya yung pinaka finest or mas finest pa. So by the time we toothbrush our teeth, hard pa, no? You have to brush it harder. So what happened? You're removing a portion or a percentage of the surface of enamel. So what happened there is that natatanggal mo yung first layer, unti-unti. A percentage of a first layer of enamel is removed. So ang mangyayari, maputi. Right? Puputi po siya. But if you continue doing it, what happened? Lalabas na yung second layer. If you want to do it, siguro once in a while, siguro after 6 months or after 1 year, you do that with a baking soda or charcoal. Kaya nga ang controlled toothpaste yung binibenta natin sa market. Like wala po ang hold sa sa mga Colgate, sa Happy, sa Close Up. So controlled po yung size and microns ng ating mga baking soda na nakalagay po doon. Sa charcoal, yun lang yung worry natin. So nasa social media po yan and hindi din namin makontrol ang social media right now. So nakikita namin, maputi. Pero later on, pag wala na yung puti, wala nang enamel, then that's the time that we dentists would get in. Ano nang gagawin namin sa kanila? So labas na yung second layer, right? Ang second layer, pagka nailabas natin, that's the yellowish color ng teeth. Siya yung nagbibigay ng yellowish color ng teeth natin. Okay? So, pagka lumabas na siya, mangilo na din. Kasi nandun na yung mga small and mga small nerves na nagbibigay ng sensitivity sa tooth natin. Pag nandun na siya, the dentist would get in, then we could already provide the crowns for them, cover that cap, give a cap on that tooth na wala ng first layer. So initially, I'm not an advocate for the charcoal. Siguro once in a while you could use, pero if you use it regularly, hindi po siguro, hindi on myself, I'm not fun for putting too much hard or parang yung mga powderized microns doon sa ipin ko, lalo pag iba-brush ko siya. As much as possible nga, when we do our brushing, normally kasi di ba nararamdaman natin, may rinig na ay naririnig ganyan, ano? It's too bad also. Kasi ang nangyayari, we scratch our teeth. Pag scratch nung teeth natin, ano nangyayari? Nagkakaroon siya ng mga lines. Parang salamin, you try to look on the salamin, right? On the mirror. Try mong i-brush natin yung mirror. Mawawala din yung pinaka-shine surface niya, right? So, yung shine ng mirror, pagka nawala, nagkaroon siya ng scratch doon sa mirror, meron na tayong tendencies. Kung saan kakapit yung una, yung food na natuyo, yung laway na natuyo. And of course, doon na magkakaroon, kahit anong toothbrush gawin natin ngayon, Dok, bakit ang baho pati nung hininga ko? May bad breath pa din. Because some of those rough surface, nandun na ngayon, nagstay yung ating mga natuyong mga food debris, drinks that na hindi natin na natanggal kaagad. So, yun yung nagbibigay din sa atin, one of the factors kaya nagkakaroon ng issues of bad breath. Okay. Actually, sa ADA, charcoal, use of charcoal, sabi nila, you could only use it at least once in a week as possible. Okay. Pero yun pa din, it's a form of abrasive pa din. It's a form of abrasive. So if you want to take care of your teeth, we can just use the regular toothpaste with fluoride onto our teeth. Yun po.
Doc, one last question. What is the best mouthwash? Even if shown in the commercial after brushing, use mouthwash or before brushing, mga ganon.
Okay. Best mouthwash. Actually, magkakaiba po kasi yung use of mouthwashes natin. If you want a mouthwash that is based with oils, you could use the Listerine or Astringosol or Oral-B. They are very good, okay? Kung regular mouthwash lang, you need something with oils, okay? Like this one, Astringosol, Oral-B's, and kahit po yung nasa mga Watsons or regular markets, yung mga malalaki, you can buy that. It's good. But if there is something that would trigger, for example, into our pulmonary, the best is for those who are smokers, you could use the chlorhexidine-based material. One of this is Peridex, Orahex. So the reaction to this, if you gargle this mouthwashes at a 5 ml per day, the use of this one is 5 ml per day. Kasi if you use this very regular for morning, lunch, and evening, you'll be having a dry mouth. Okay, so you just use it once a day for 1 week. Then after that, you stop for a while, then go back again after a week time. Okay, ang maganda dito from the research, the chlorhexidine reacts, at least they reduce the bacteria in the mouth and in the throat area. On the throat going to the lung area, they reduces the bacteria and infection at around 97 to 99% now from the research, okay, for the Peridex and the Orhex, for the chlorhexidine. If you want to use an iodine base, like a betadine mouthwash, kung may mga ulcers, no, best mouthwash for those patients with ulcers, you have to use a betadine. It's a 1% betadine. Then this would help a lot. Okay. Si Bactidol, I would consider it. You could use the Bactidol Same way with the astring sols and oral Bs on that side. Okay. Then when you gargle, you have to use a 5 ml pure. Do not dilute it with water. Gargle it as much as possible. Kung mariremember nyo po yung patalastas ni Christopher De Leon, going back, yung pumutok yung nag-gargle sa boom. So dapat ganun yung pakiramdam natin na mag-take effect muna yung mouthwash before natin siyang spit out. Okay? Kasi ang nangyayari, pagka naanghan tayo, we spit it out already. So, hindi pa siya nag-take effect din sa oral mucosa natin. So, then, ano na kagad, didura na natin yung ating mouthwash. Ngayon, pagka nag-gargle tayo, when you gargle, as possible, clean also the throat area. Yung iba, pinapatunog pa, di ba? Then move on the left and right and all the sets of the teeth. So, in that way, mararamdaman mo, hindi lang fresh yung bibig mo, pati yung nandun sa throat area mo, nakiklean natin. Okay? This is also very good in these times of pandemic to our patient. Before they get in, lalo dun sa mga clinic ninyo, we could already reduce. Sa amin po kasi, it's a protocol. Before they get in to our clinic, they have to gargle with these mouthwashes like the chlorhexidine. Si chlorhexidine kasi talaga matapang, sobrang tapang nito. And this reduces the virus, bacteria in the oral cavity. So they gargle from the throat area to the mouth itself. So pagdating nila dun sa patient nyo, hindi man 100% na-reduce ang bacteria, at least meron tayong 50 to 70, it's good already kasi magre-rehydrate ulit ito sa loob ng bibig ng patient. Okay? So kung magkaroon ng dehydration naman dun sa loob ng bibig ng patient, at walang budget, ito dun sa mga cost-cutting na patient, Doc, hindi ko kayang bumili ng mouthwash. Mahal. Kahit 10 pesos na lang or 15 pesos. Mahal pa din yan, Doc. So what you could do, what you could use, warm water with salt. Okay? Sa isang baso, isang kutsarang asin. Okay? So halo nyo doon, warm water, then the patient, or you can gargle with this one. This is very helpful also. Okay? To some, they use also the VCO. It also helpful. It is very also helpful. Okay.
Look, there's some more question, pero as time a lot, so we have to cut the question. Doc, thank you for all your for the lectures and answering our questions. So very informative talaga, Doc. Thank you, Doc.
Opo. Thank you din po.
Burn.
Yep. Can I?
Then we will going to have a raffle. This is the last raffle we're going to give you. For this raffle, you will win. How many? We had 3 winners for the pulse oximeter. So there are 11 more winners of pulse oximeter and 2 PPE. Burn. 2 PPE winner. And for the grand prize, we have 1 stationary bike. Don't worry, hindi na tayo magtatagal kasi lahat lang ng naka-login, yun lang ang kasali sa raffle. Kaya wag na kayong aalis dahil pag wala kayo, sorry. Okay, Vern, let's start the raffle.
Dr. Jamin, habang kompleto pa po tayo at marami pa, can we just have po request everybody to let's have a picture muna before we go on with our Merry Christmas raffle po, dear doctors.
Okay.
Ako na lang po.
Please open your video.
Ay, meron lang excited sa stationary bike.
Tayo.
I will take the picture po. Just turn on your cameras po. Let me, yan po. We only have 2 pages, so mabilis lang po ito, dear doctors. Yan, sige po. We'll give you time to turn on.
Toko, nasan ka? Ceiling na yung nakikita namin sa inyo.
Turn on your cameras po. Yan.
Tulio, yes. Dr. Tantoco, Doktora Magnolia. Yan. Please open your videos, everyone. Dr. Chabet. Sino ba? Hindi ko makita. Alan, hi. Alan Thailand. Doktora Wing. Mama Grace. Sino pa? Sharon. Dami pa hindi nag-open eh.
Sige lang
Please
po.
open your video, Dr. Ambe. Dan. Rene. Sige na, hindi ko kayo papapanalunin. Hindi kayo nag-open ng video.
Mahigpit ang
Dr.
criteria.
Fatma. Okay.
I think si Dr. ata driving nagbanggit na siya kanina. So, okay lang if hindi siya maka-on ng video. So, okay na po. Let's,
Okay.
ayan, marami na po. Dr. Jamin, I will take po the first screenshot. Just maintain po yung inyong wonderful smile kasi po hindi po natin maalam kung saan po kayo naka-page. Hindi nyo po masabi. Baka sa page 1 or page 2. Alright, I will do the countdown po. Alright, 1, 2, 3, smile. Alright, that's the first screenshot. The second page.
Yung smile, ganda pa naman ang lecture natin, all about it.
Second, ano po, second page. Sorry, 1, 2, 3, smile. Alright, okay po, nakuha ko na po. Thank you. Alright, now, Doktora, tuloy na po. I will share the slide again. Ito na pala, yan.
Ako na, yehey.
This is for an 11 pulse oximeter muna po. All right, here we go.
The winner is Doktora Ayi Rotor. Doktora Ayi. Please open your audio.
Ayun.
Thank you po.
Okay, thank you. Congratulations. Okay, Dr. Toti Hipolito.
Congratulations.
Dr. Toti.
Nakita ko siya kanina.
Dr. Toti.
Nakita ko.
audio. Dr. Toti. Wala. Lynn, wala na si Dr. Toti.
Andyan na ako.
Nito, yan.
Merry
Thank
Christmas.
you.
Gusto ko stationary bike sana. Thank you. Thank you. Merry Christmas.
Merry Christmas, Dr. Toti.
Doctora Cuesta. Where are you?
Nandiyan po si
Wala na ba si Doktora Cuesta?
Ayun. Andyan pa po, Doktora. Nagsalita.
Okay, congratulations.
Congratulations.
Maggie and Breve. Maggie, saan ka? Nandiyan ka? Maggie. Yun. Maggie. Nandito si Dr. Maggie. Maggie, unmute yourself. Andyan siya.
Andyan, okay. Sige po. Next na po, Dr. Jamin.
Yes.
All right.
Dr. Elnora Portu. Dr. Portu. Yan ka po.
Nakubalis na siya, doktora.
Ay, wala na.
Balis na.
Okay. Another one. Dr. Kuya. Kuya, nandyan pa. Dr. Elwin. Nandyan si Kuya. Kuya, nandyan ka pa. Or Elwin. Wala na si Kuya din.
Andyan pa, doktora. Naka-login pa po siya. Naka-login pa siya.
Okay.
All right. So,
Next.
ano, winner, doktora?
Hello.
Ayun.
Yes, good.
Hindi ko ma-unmute.
Congrats, doktor.
Thank you. Merry Christmas.
Merry Christmas.
More. Dr. Lourdes Torio. Oratorio. Nandiyan ka pa ba?
Ayan, nag-message po.
Yan, yes.
Congratulations po. Merry Christmas.
Dr. Carmencita Lapus.
Hello.
Yan, congrats, Doktora. Thank you.
Thank you.
Dr. Ruth Moica. Dr. Ruth.
I'm here.
Okay, Merry Christmas.
Merry Christmas.
More. Dr. Karina Martinez. Dora, are you here? Dr. Karina. Dito pa. Wala na yata.
Nandyan po siya, doktor, kaya lang
Hindi naka-unmute.
Opo.
Yan,
Okay.
inask doktora. Ayan. Pero nandyan pa po. Tama.
Okay, dalawa na lang.
Alright, dalawa na lang po.
Dr. Babe Thompson.
Present.
Wow, ang galing.
Thank you.
Manang
Merry
Babe.
Christmas.
Merry
For the
Christmas.
last winner.
Yay, nakapag-unmute din sa wakas.
Pulse oximeter, last winner.
Lagay ko bike.
Dr. Frances Din Quebec. Dr. Frances.
Ayan,
Ito pa.
nag-on siya ng camera.
Andito ba siya?
Nandyan po, nag-on siya ng camera.
Okay. Now.
Congratulations.
Bike na, bike na.
Okay.
Wala pa. PPE pa. 2 PPE.
Alright, PPEs.
Yes.
Bike, bike.
Dora Peret Miguel.
Naku, sayang. Sa bike.
PPE ka.
Thank you.
Last PPE.
Ruel Santiago. Ruel.
Andito
Present
po.
ka?
I'm here.
Okay, thank you. And for the grand winner.
Para pahabain natin ng konti ang spinning time, mga 10 seconds. 10 seconds. Ayan, tapos i-shuffle natin, doktora. Shuffle. Para sa bike. All right. Ito na po for the stationary bike.
Dr. Alif.
Good luck po sa lahat.
Yan. Rera
Raffle.
May raffle daw. Donate daw,
Donate
Doktora.
pa, donate pa.
Donate.
Doktora Pat.
Masyadong malayo yan. Di yan madadala doon.
Oo nga, tama.
Pat Matthew, sexy ka na. Pamigay mo na yan.
Okay, thank you.
Tanong
Donate
natin
ba,
siya.
donate?
Tanungin natin.
Doktora Pat.
Pat. Donate.
Donate ba?
Donate.
Lang nag-message na po si Doktora kanina na
Ano?
maglilib.
Oo, actually nag-message siya kanina na I will have to go, sabi niya.
Oh, di wala siya. So,
Alright. Ano, Doktora? Re-raffle?
Wala na siya eh. Oo. Wala na ba?
Raffle.
Nandiyan pa.
ano?
Raffle ulit.
Ayun po.
Raffle ulit daw, sabi ni Madam Marcy.
Alright, Doktora. Decision po, Doktora Marcy.
Doktora Marcy magbibigay pag hinabol ng Doktora Pat.
Makakabulin.
Hindi. Wala.
Final answer. I-spin ko po ulit.
Yes daw, sabi ni
Alright.
Doktora
Wala
Marcy.
siya eh.
Moneta, sir.
Alright, spin the wheel.
Wow, congratulations, Dr. Charlie Hidalgo Ornum. Doc, nasan ka?
Hi
Open
po.
your video.
Hi,
Ka.
thank you po.
Ako, nandyan na.
Ay, hindi na po open video. Naka-open ba?
Hi.
Hindi ka namin
Opo.
nakikita.
First ang spotlight ka namin. Ayun.
Dito po. Hello.
Congrats, Doc.
Hi po. Merry Christmas.
Christmas, Happy New Year. Okay.
So, thank you.
Pa-message po sa lahat ng winners.
Thank
Bye,
you.
yung class.
Mananalo. First time mananalo.
Doktora, yan po yung napatuloy ko.
Doc, for all the winners, please wait for the text of Lynn kung paano namin sasend yung mga prizes nyo, ha?
Thank
Matagal,
you.
i-check nyo si Lynn. Okay.
Message niyo po ako sa ito po.
Okay, burn. So, in behalf of the PSD Board 2020-2021, we would like to thank you everyone for all your support. Laging nandyan sa lahat ng PSD Select namin. And with the new PSD Board, plus our beloved PSD Secretariat, Lynn Bisco Pereras, would like to greet each and everyone a Merry Christmas and a prosperous New Year to all. And see you all again and hope i-follow pa rin ninyo kami, samahan sa lahat ng aming next year activity. But we're going to have our first activity this coming January. Merong care of burn pa rin, LRI Terra Pharma. Wait na lang for the announcement kung anong
Yes,
gagawin.
Doktora. Thank you so much.
Mo rin sa kanila na any suggestion, we welcome them for any topics that they want us to discuss, and we'll look for expert for their topics na gusto nilang i-discuss sa PSD Select.